Good morning, my name's Dr. Jeremy McAnulty from New South Wales Health, and I'm here to give you a COVID update for New South Wales for Saturday the 20th of November 2021. There were 182 new COVID cases reported in the 24 hours of 8 o'clock last night. In the same period, there were more than 60,000 tests reported. In terms of vaccination, now 94.3% of people aged 16 years and over in New South Wales have received their first dose of vaccine, and 91.7% are now fully vaccinated. Of people aged 12 to 15 years, 80.9% have had one dose and 74.9% are fully vaccinated. In terms of hospitalisations, there are now 191 patients with COVID in New South Wales hospitals, 28 in intensive care, of whom 17 require ventilation. Of those in ICU, 21 are not vaccinated, 3 have had one dose of vaccine and 4 have had 2 doses of vaccine. New South Wales sewerage monitoring system that looks for evidence of the virus in communities, sewerage systems have found positive samples in Tumut, Uralla, Wardell, Eden, Geraldary and Tweed Kingscliff, where there are no current known cases. So people living in these communities, please monitor for symptoms and come forward for testing right away should you get any even slight symptoms. In this phase of the epidemic, the onus is on every one of us to keep each other safe. While we have high vaccination rates, we all need to remain vigilant. If you haven't been vaccinated yet, please get a vaccine, or if you need a booster, because it's now 6 months since your second dose, please get a booster. It's particularly important now 12 to 15-year-old children who get vaccinated, and you can get vaccinated through your pharmacy or GP or one of the clinics that New South Wales Health runs. If you have any symptoms at all, please get a PCR test at one of our testing clinics. A RAT test or rapid antigen test isn't suitable for confirming a diagnosis in people with symptoms. New treatments have become available for COVID-19 in Australia, especially for people with underlying health conditions who are likely to have poor outcomes from COVID. And most treatments work best if given early. So it's important to get tested for COVID early if you do have those symptoms, again at one of our testing clinics. If you have had a self-test, rapid antigen test that's positive, it's critical to get formally tested to confirm your result at one of our PCR testing clinics. This will ensure that New South Wales Health can connect with you while you're in isolation and provide care and resources to keep you and your family safe. And if you do have symptoms and they get worse, please connect with your doctor right away so you can be appropriately managed. Again, thanks to everyone for coming forward for vaccination and testing if you have symptoms to help keep us all safe. Thank you.